I went to college and wanted to do biomedical engineering. But it wasn't until my third year of medical school that I got out into the communities where I actually saw patients, that I saw that I really had a love for this type of medicine, for primary care. And so for me, it was a decision, what is it that I really wanted to do? My heart was in the primary care. I'm Brian Freeman, NHSC Students to Service Loan Repayment Recipient. Right now, I'm a third-year family medicine resident here at Fairfax Family Practice. I'll be looking forward to start my service commitment. My immediate goal is to get into an environment with the National Health Service Corps that I can see myself in for longer term. I actually look forward to it because working with underserved populations, you get to see things with these populations that you don't see in affluent populations. And how long were you congested for when you were pregnant? Especially in primary care, you need to be able to communicate with the wide range of people from all different socioeconomic backgrounds and conditions. Have fun with those babies.
All right, thanks.
Underserved communities means to me working with these people to fill a gap, to allow them to have good health care just like anyone else would. In primary care, especially family medicine, we are their one-stop shop about 90% of their health care needs. We say it all the time here in family medicine. It's that relationship that you have with the patients. And it's cliche, but it's not really cliche. Because if you have a good relationship with the patient, you can stave off a lot of healthcare concerns that a patient has. Up on your toes and down. Good primary care is primary care that you are actively involved and are the patient advocate.
Great, doctor. Thank you very much.
Primary care has that challenge and it had to attract people to come to the field when student loans is such a big issue. And that's why this program is so great, the National Health Service Corps. Money is a consideration for 100% of our medical students in this country. I like primary care, but I'm not going to make enough money to pay off my loans. This new program by the National Health Service Corps is called the Students to Service Program, which was great because it wasn't a scholarship program where you had to be committed to it in med school. It's something that you can apply during your fourth year when you're already applying to residency anyway. And so for those of us who are applying to primary care fields, this program is excellent because it gives you the ability to practice what you love to do, but then not have that financial burden associated with it. I thought it was perfect. When I got the email saying that I had received one of the awards, $113,000. It literally was a huge sigh of relief because now I recognize, my financial burden is almost gone. Last month, we welcomed my first child, a daughter, to the world. Her name is Amaya, and she's been a great joy for us. A lot of work, but a lot of joy. I know now that we can start saving for her college education, thinking about getting a house when I get out of residency as opposed to staying in apartment living for several years afterwards. And so it really just frees us up to do the things that we like to do. The benefit of being in the National Health Service Corps is seeing the widest possible range of patient populations, of disease states, of clinical conditions, of socioeconomic backgrounds. That will make you able to be a better communicator, a better leader, a better administrator, because you have a wide range of experience. It's a good way to give back to my community that's helped me growing up. Personally, I can say that a lot of my family, my cousins, my extended family, my grandparents, and my parents when they were growing up too, are underserved. They're from rural or very urban inner city communities where the access to healthcare is not good. I get to serve this population who do a lot for all of us. I only feel it appropriate for us to help them with their health care as well.